Hello everyone. I will be continuing on the chapter of amoebiasis. This I will be dealing in detail about extra-intestinal amoebiasis, as we have completed about the pathogenesis, the clinical features of amoebiasis, intestinal amoebiasis, and laboratory diagnosis as well as treatment. Coming to the extra-intestinal amoebiasis, as you can see, the title itself says extra-intestinal, something which is outside the intestine. So amoebiasis which are set up in these regions are referred to as so. It is seen in about 5 to 10% of the patients that they develop this extra-intestinal amoebiasis. So liver is the most common organ which is seen to be affected in extra-intestinal amoebiasis. The trophozoites can also travel to the other organs such as the lungs, brain, the genitourinary tract, and also the spleen. We will be dealing in detail about amoebic liver abscess, since liver is the most common organ which is involved in extra-intestinal amoebiasis. So, where does this abscess develop? So, the trophozoites from the intestine, they travel into the region of the liver. First, I will just show you the life cycle. This is just a brush through of what has already been taken in the previous class. The life cycle. So, once there is ingestion of the cyst, excistation takes place in the small intestine. It results in formation of the metacystic trophozoites. So, these metacystic trophozoites, they travel into they multiply and they colonize in the large intestine. From the large intestine, they set up an infection resulting in formation of what is called as a flash-shaped ulcers. Now, from this region, through the bloodstream, it enters in, that is particularly the portal circulation, it enters into the liver. And now, once the trophozoites are present in the liver, they start causing damage to the hepatocytes which are there, and they set up an infection. And that is nothing but the amoebic liver abscess. So, what is the most common site that the abscess is seen? It is the posterior superior surface of the right lobe of the liver. These abscesses, they can either be single or they can be multiple abscesses. So, what happens for this abscess to develop is the capillary system of the liver, as we all know, it acts as an efficient filter. So, since it acts as an efficient filter, it holds back the trophozoites which are present in the bloodstream. So, now these trophozoites, they get collected in the hepatocytes of the liver, and they start multiplying and they cause destruction. So, what happens is they cause obstruction to the hepatic venules, resulting in ischemic necrosis of the hepatocytes and setting up an inflammatory response, resulting in formation of abscesses. These are the small abscesses. Now, a number of these small abscesses, they coalesce together to form a large abscess. You can see in the picture, this is a large single abscess seen on the posterior superior surface of the right lobe of the liver. This is the life cycle. Coming to the clinical features of amoebic liver abscess, what does the patient complain of? So, first there is fever, weight loss with profuse sweating, and he also feels weakness. Along with that, there is abdominal pain. In particular, it is the right upper quadrant of the abdomen. And on examination, once they do an ultrasound, they get to know, the clinicians will identify that there is a amoebic liver abscess. So, we need to drain out the abscess. So, once we drain out the abscess, the discharge is referred to as the anchovy sauce pus. Okay, it is a pus which is thick in consistency, and it is chocolate brown in color. What does it contain? It contains the necrotic hepatocytes, but it does not contain any kind of pustules, and there are also no amoebae. So, therefore, it's referred to as the sterile pus. So, how did this pus derive its name as anchovy sauce pus? Anchovy is a species of fish. So, they make this sauce called as the anchovy sauce, and the discharge or the drain drainage of the pus. The color resembles the anchovy sauce, so therefore it is referred to as the anchovy sauce pus, which is seen in amoebic liver abscess. As you can see, the clinician has drained out the pus, which is thick and chocolate brown in color, which is seen in the tray there. Coming to the lab diagnosis for amoebic liver abscess, the sample is the diagnostic aspiration of the pus is done. So that pus is sent to the laboratory. Microscopically, we can see the trophozoites, and there is also varying degrees of necrotic liver cells. We can do an antigenic detection of the pus, and then subject the patient's blood for serological examination, either by ELISA, latex agglutination, or by countercurrent immunoelectrophoresis. Histopath also plays an important role, wherein they subject the sample to PAS stain, and we can see the pink colored trophozoites. Any case of abdominal pain, most of the times we ask for an ultrasound. So if nothing can be detected in the ultrasound, we can also go for the other imaging techniques, like we can ask for the CT, the MRI, and also do a radio isotope scanning, and all of them you will find what is called as a classical space occupying lesion. Lastly, we can also do a molecular diagnosis by PCR. Treatment, any abscess, only once it is drained out there is relief to the patient. So obviously drainage of the abscess is one of the treatment modalities for amoebic liver abscess. Along with that, the symptomatic treatment should be given. If there is fever, that needs to be taken care of, and in order to avoid further multiplication of the trophozoites, we give the patient metronidazole, or a combination of tinidazole and chloroquine can also be given to the patient. That was about the amoebic liver abscess. Now these trophozoites, they do not only again limit themselves to the liver, they can also travel to the other organs. They can travel to the lungs, resulting in pulmonary amoebiasis, or they can move into the cerebral region, resulting in cerebral amoebiasis, to the spleen, causing splenic amoebiasis, sometimes to the genitourinary region, resulting in genitourinary amoebiasis, and lastly, they can also be visible on the skin, resulting in cutaneous amoebiasis. And in cutaneous amoebiasis, it is usually seen on the region adjoining the visceral layers. And sometimes they can also occur as the complication of amoebic liver abscess, wherein the condition is referred to as the granuloma cutis or the amoebiasis cutis. Again, this is a picture where you can see from the intestine it goes into the liver. From the liver, the trophozoites can go into the lungs and cause an abscess there, then into the brain, into the spleen, into the genitourinary regions of both the males and the females. So it can also result in amoebiasis cutis. So this is all about extraintestinal amoebiasis. Thank you.